Hi all, welcome back to my channel. I hope you guys are doing good. Today I am going to discuss about gynecological history documentation. As a part of history collection, it is mandatory to collect the gynec history if your patient is a female. Let's move on to the topic. Here are some points we need to collect when it comes to gynec history. The first one is LMP, that is last menstrual period. The first day of last menstrual cycle. You have to ask and document. The second one is menarche. That means the first menstrual period, when it starts first. And menopause. That means when the periods stop. The next one is regularity and cycle length. So you have to ask whether it is regular or irregular. That means regularly every month it will come if it is regular. And the cycle length is between 21 to 35 days. It's considered normal. That you have to ask and document. The next one is duration of period. So once the menstruation starts, how long it will be there. For some, it may be there for 5 days, and for some it may be there for 4, 6. Okay, you have to just ask and document that one. Up to 7 days, it's considered normal. And character of periods. So you have to ask whether they will be having any pain during the menstruation, whether the bleeding is heavy or less. Everything you have to ask and document. And also any vaginal discharge and contraceptive methods, if they are on, you have to mention that too. So here are some terms which denotes abnormal menstruation. Let's see about that. Menorrhagia, that means excessive menstrual loss at regular intervals. So there will be more bleeding but at regular intervals. The second one is metrorrhagia, that means frequent and irregular menstrual loss. So in between the periods it will come frequently and it is irregular. That is known as metrorrhagia. The third one is polymenorrhea, that means regular cycles at less than 21 days. I mentioned already, if the cycle is between 21 to 35 days, that is considered normal. So here in polymenorrhea, regular cycle at less than 21 days, like 20th day, every 18th day, it will come. Then oligomenorrhea means infrequent menstruation more than 35 days. The last one is intermenstrual bleeding, that is bleeding between menstrual period. Before the normal regular period, in between the normal regular period, there will be bleeding, that is intermenstrual bleeding. So after collecting those basic history, you need to collect this history too, especially if your patient is married or having kids. Let's see about that in detail. Here is an acronym GPLAS, GPLAS. So G stands for gravida, which means number of times a patient has been pregnant. Second one is para, P, number of times a patient has given birth to a viable child. Viable child means the ability of the child to survive outside the mother's womb. So usually it will be after completing 24 weeks of gestation. The third one is L, live birth, which means birth at which a child is born alive. So here the complete expulsion of the fetus which shows signs of life is known as live birth. Next one is abortus, as you all know, is a term used to describe a pregnancy that ended for any given reasons, including both abortions and miscarriages. The last one is yes, stillbirth, which means when a baby is born dead after 24 completed weeks of pregnancy. So if it is happening before 24 completed weeks of pregnancy, it will come in the category of abortion or miscarriage. Let's see how to document GPLAS with an example. A 45 years old woman has 2 children, history of 1 abortion and 1 stillbirth, attained menopause at the age of 42 years. So here G, gravida, which means how many times she's been pregnant. So 2 children, 1 abortion and 1 stillbirth. Totally 4 times she got pregnant. So you can mention G, 4. Next one is P, para. How many times she delivered a viable child. So here 2 children plus you have to consider the stillbirth also, because the definition states when the baby born dead after completing 24 weeks of gestation is considered as stillbirth, and also delivered a viable baby. So the criteria says if a baby completed 24 weeks of gestation, that is considered as viable child. So along with this 2, you have to consider 1 stillbirth, totally 3. So P is 3. Next one is live birth, live child. So she has 2 children. You can mention L2, A1. That is, she had a history of 1 abortion. So mention A1, and also had a history of 1 stillbirth. So you have to mention S1. And also here she attained menopause at the age of 42 years. That also you have to mention. Attained menopause at 42 years. Clear? How to document if a woman has never been pregnant or had a history of 1 abortion. Here is the term nulliparous. Next one is amenorrhea, which means absence of menstruation, that is, missed 1 or more menstrual period. Thank you so much for watching this video. I hope you got a clear-cut idea about how to collect the gynec history and how to document. I guess this would be helpful for you guys. If you feel the same, kindly like, share this to your friends and subscribe my channel. Don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.